What's up, guys? It's time for another Reddit thread. I scoured the internet. You know what I found? Nurses and doctors of Reddit. What is your "they never taught this in school" moment? The first thing that pops into my head is actually something very meaningful to me that I'm going to be doing a whole campaign around in the coming months. It's about the fact that we as doctors in medical school were not properly trained to take care of those with disabilities. As doctors, we're trained with simulated patients on pelvic, prostate exams, running code blues, difficult interactions, but not with patients who may be blind, may be deaf. These are important things that we need to learn as medical students. Like when I had my first patient who happened to be blind, I didn't know the proper etiquette. I didn't know if I should show them the way to their seat. I didn't know if I should tell them what I'm doing before I do it. We need more education and we need to step up there. Come on, medical schools, pay attention. All right, let's get to this Reddit thread. A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. I think that could be considered a crime. I think that police would get involved in a situation like that. Interestingly enough, in the hospital, if you are performing, let's say, a procedure like an injection, and you accidentally give yourself a needle stick, you have to test yourself and start taking prophylactic medication to try and decrease the likelihood of exposure. But first thing you have to do, if you get any kind of injury like that with a needle stick or a scalpel, is wash your hands with soap and water. That decreases the rate of transmission of a lot of infections. Most people don't think about that. They cut themselves, they start covering it to make it stop bleeding, but you gotta wash it. You gotta wash it out as best as you can and as fast as possible. Took care of a young man with a GSW wound to the abdomen. He had many complications. He was in the hospital for over a year. He had an ostomy bag for a while, but when they finally removed it, he was so nervous because he hasn't pooped in so long. His call light goes off and he says, "Go look in the toilet. You're never gonna believe this." I go in there and there's poop in the toilet. His first solid poop I had seen in over a year. I walked out and gave him the biggest hug. He was so proud of his poop. I walked out of his room with tears in my eyes. Nursing school never prepared me for crying outside a patient's room because I was so happy they had pooped. That's one of the most heartwarming stories I've ever heard. So when you have any kind of injury to the intestines, let's say through an infection with a perforation, meaning that the intestine actually ruptures, or a stab wound, gunshot wound, what have you. A lot of times what you have to do is create an ostomy, which is an opening in the abdominal wall where you have a little baggie and your poop essentially collects in that area. You have to constantly open and drain that bag. Now, it's not very comfortable, but the goal is usually to have this as a temporary site where then you go in and do a second surgery and reconnect and have the patient start pooping again. This is a very tedious process, nerve-wracking process, and you have to really wait and hope that the poop goes well. The fact that this happened, the patient was very happy about it, this nurse had to experience this. I mean, this is awesome. It's feel good. Feel good fairy dust all over it. When my mom was fresh out of nursing school in the 80s, she got a job at the hospital that had a high concentration of geriatric patients, aka elderly patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in, my mom and another nurse tried to put them back in as to not horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely didn't prep her for that nightmare. I could see that being difficult. God, there's so many different things that happen when the patient passes that you have to be so respectful and you're not ready for. Part of what you have to do as a resident, especially as an intern, is to do something called pronouncements. Is when a person passes, you have to go in and do the time of death. You listen to heart sounds, lung sounds, you check a few reflexes, and you have to certify that the patient actually did pass. Notify next of kin, the doctor, start the death certificate, all these procedural steps you have to do. No one can prep you for that. In fact, the majority of these death pronouncements are done on patients who are on hospice care so that you know that they were going to pass, at least the family's ready for it, and it's still never easy. It's probably one of the most difficult parts about being an intern. You're just not ready to have these conversations, but also just having so many of them. Women will pee and poop during labor. It absolutely happens. Ribs crack during CPR and it feels really weird. Yes, you have to understand the person that you're doing CPR on is technically not alive and you're trying to bring them back. A broken rib is worth bringing someone back to life. Student nurse here, how to hide the looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him when he was putting a patient's prolapsed rectum back in. Awkward. You know what? That is actually tough. And in the last responding to comments video, someone mentioned like, how am I a doctor with a gag reflex? It's tough. Look, like, just because we're doctors doesn't mean we're not human. You try and be respectful as possible and you become more attuned to these things as you have more experience. But early on, if something happens and you inappropriately respond to it, own up to it. Patients appreciate that. Look, they're humans too. They understand what's going on. But if you truly care for someone and you're not just faking it, it's gonna show whether you laugh at something inappropriate or not. All those things you encourage your patients to do, eat well, exercise, get enough sleep, also apply to you. I know too many nurses who don't take care of themselves mentally, physically, or emotionally in a very draining environment. Self-care is incredibly important and sometimes we'll lose sight of ourselves in trying to take care of others, but we're of no use to anyone if we're running ourselves ragged. This is so true. Doctors, nurses, physical therapists, pharmacists, we need to take care of ourselves. We need to make sure that if we're gonna teach patients about how they should live their lives, we should do that for ourselves as well. Even for myself with this channel, I tell you guys that you should get 7 to 9 hours of sleep. When I get less, I feel like I'm not being honest or genuine with you guys. So I'm trying to become more cognizant and take care of myself so that I can inspire you to make those same changes. And if I can do it with a crazy hectic schedule bouncing around all over the place, I want you to know that you can do it too. And if we slip up every now and then, doesn't mean anything bad. It's about getting back up on that horse. That you will get yelled at by a doctor, patient, fellow nurse, charge nurse, etc. for something that was not your fault. The first time I was yelled at about not calling in a morning lab that wasn't a critical result, it was hard not to take it personally and I did need a minute to recover. Since then, I take criticism better, but sometimes we all yell, especially in high stress situations. This happens. This absolutely happens. Hospitals are high stress, not only high stress in the moments where it's like, you need to think quickly like a code blue, but also when you've been up for 24, 36 hours, you're not the nicest person. So have I seen doctors say mean things to nurses? Absolutely. Do they regret them and work it out afterwards? Absolutely. It's really important that you also let things roll off the shoulder a little bit, do a little Floyd Mayweather shoulder roll, because otherwise it's very easy to choose to get offended by something and lose focus of the greater goal, which is to become better every single day as a medical professional and to be a better person overall. I'm a psych nurse in a mental hospital. 90% of my job is they never taught me this in school moment. I get that. You can't prepare for psych. There's just too many unknown variables. What you have to do is know how to stay safe in all types of scenarios because it's very easy to have things get out of hand. But once you know that, you can then adapt and learn from your own experiences. There's been plenty of times I've been on the psych ward and patients approach me and I think it's someone, a family member asking for help, when in reality, it's a patient having a full conversation as if they knew me from day one. It happens. Being comfortable with uncertainty. In the beginning, being unsure of a diagnosis or treatment plan seems like a personal failure of knowledge. This leads to over-testing, over-treatment, all to film an overwhelming sense of missing something. Over the years, I've come to realize that most of the time, there isn't one right answer or approach. I'm gonna upvote this comment. This is a really good comment here. This is someone who's actually practiced medicine and knows what's up. A lot of times patients come to us for answers and we feel like we need to please them by telling them that we know or we will figure it out. And most of the time we can figure it out or at least have some steps towards figuring out. But the most honest thing we can say is, here's what we can do to try and figure out, but we can't promise to have an answer. So if a patient comes to me and they have all the signs and symptoms of a common cold, mild fever, runny nose, clear rhinorrhea, which means clear mucus, maybe a mild sore throat, a mild cough, I could tell them that I think that they have a common cold. Am I 100% sure? No. Do I even know what upper respiratory virus they have? No. Could it be something much worse than that? Absolutely. But what we do in medicine is we pick the condition, not pick, that sounds kind of arbitrary. We decide based on the history, presentation, the physical exam, maybe the test that we order, what we think is going on to be most likely. We rule out the things that can hurt you right now in the given moment, and then we say that's what we think is going on, and we work off that. Now that's called a differential diagnosis. You name a list of things that you think are going on, with the top one being most probable, and you work out to figure out which one is most likely. And maybe you start treating The first one, if the treatment is not so harmful, or you're very confident in your diagnosis, and you work from there. But will you have to answer every single time? Absolutely not. Will you make a mistake? Absolutely. There's been countless number of times a patient comes in with, a mild abdominal pain, a little belly pain, that I say, you know what, it's only been a few hours. We found this incidentally. Let's see what happens. Next day they come in with full-blown appendicitis. Did I miss it? No. I can't assume everyone with a little belly ache has appendicitis, especially if it's not presenting in the most typical way. So we label it abdominal pain, and then when it becomes appendicitis, then we have a proper diagnosis. It's very tricky. Medicine is one of those fields you have to be very comfortable with being uncomfortable. No one quite prepares you for the first time someone says, great, the doctor is here, what should we do? The first time you have real responsibility and authority after graduating medical school is terrifying. This is absolutely true. You go from one day to being just a med student who's there to learn and just ask questions, to the next day, nothing changed, just overnight, a few hours went by, and now you're coming in as an intern, as a doctor, where people are gonna ask you questions. It's quite scary. I remember my first day, I asked a lot of questions of my senior residents simply because I didn't want to make a mistake. The nurse pages me about a patient having high blood pressure after surgery. I call the senior residents. I'm like, look, I know what the options are, but how do you know? Which one do you choose? And they said, well, which one do you think? And we went from there talking about the differences between the medications. But unless you have someone who's capable of answering those questions for you and guiding you along the way, it's very hard. That's why I recommend all students to speak up during clinicals, to ask questions so they can make their mistakes when there's no lives on the line. Because when you're a doctor, those mistakes count and cost a lot more. Taking on Reddit's fun and all, but have you ever seen me take on Dr. Google? Click here for that playlist. We'll watch it together as we stay happy and healthy.